Hello, everyone. If you've had challenges becoming pregnant, I know it can be frustrating and stressful. However, having the right information and working with the right professionals can actually be empowering. And today I have a treat for you. I have a very special guest, Dr. Carolina Sueldo, a double board certified OB GYN and reproductive endocrinologist and infertility specialist. And we're going to be discussing practical tips to boost natural fertility. So welcome, Dr. Sueldo.
Thank you. Thank you so much for having me. I'm so excited to be here today.
Yeah, me too. Me too. So before we get started, I just want to welcome you. This is Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family doctor and owner of In Touch Primary Care, and I'm so excited you're here. This is a good place to be if you desire to take charge of your health, because many serious health conditions can be prevented, and we must be intentional about our health. Remember, you can always listen to this episode and all our other episodes on the In Touch Primary Care YouTube channel. Leave comments, subscribe, and share. Someone might really need this. You never know, and it can make a big difference in their life. So let's get in. Dr. Sueldo, can you tell what you like to share about yourself personally and professionally?
Sure. Yeah. So first and foremost, Dr. Ashaye, thank you so much for having me. I think that people don't realize just how important their primary care provider is in their health journey. And a lot of times I see patients that wish they had been sent sooner. So the fact that you're talking about this on your channel, in your practice, is it's huge for patient care. So I commend you for that. As far as me and my story, so as you mentioned, I'm double board certified. We like all of our acronyms in medicine, but basically I'm a fertility specialist. I grew up in California, which is where I did my OB/GYN residency training. I lived in the Northeast for 3 years. That's where I did my fellowship. And so my specialty or subspecialty training in infertility. And then I've been in practice now over 7 years. The little thing that's different about me is that my family's from Argentina. So I actually lived there for 8 years. I spent my high school years and then also medical school in Buenos Aires. So for those who have been, it's a beautiful city, beautiful country. I highly encourage you to travel if you get the opportunity.
Awesome. I want to go, so I'm going to be hitting.
It's beautiful. I loved my time there. Obviously, it was time to come back. I've been now back in the States well over a decade, but really, really enjoyed my time, have very special ties. All my extended family still lives there.
Awesome. Very cool. So you're an experienced OB/GYN and reproductive endocrinologist and infertility specialist, and you incorporate other methods when you approach fertility. Can you tell us a little bit more about that?
Yeah, so when I talk to my patients or the audience about fertility treatment, I like to think of treatment as a three-pronged approach. So one is obviously the fertility treatment they'll be doing in the office with me, and obviously that's very important. But I also think that just as important as the medical treatment is the lifestyle optimization that the couple is doing at home, as well as any fertility herbs or supplements that they may be incorporating into their daily regimen. So when we talk about the fertility treatment, I'm not going to spend too much time on that today, but generally speaking, there are different fertility medications that can be given. So those are prescribed pharmaceutical medications. There are different reproductive surgeries that can be performed to try and optimize a patient's fertility. And then we have our advanced reproductive technologies, which for the non-medical people is IVF. That's basically where we're creating embryos in the laboratory, and there's many different ways to do that. So I don't want to get into too much detail and overwhelm the public, but generally speaking, those are the different branches of fertility treatment that we talk about in my office. Now, just as important with that is going to be the lifestyle optimization. And I use lifestyle as a big umbrella term because we really look at all aspects of health. When I'm doing the first initial consultation, I'm going into every single aspect of the patient's health. What is their nutrition like? What is their exercise regimen? What is their sleep regimen? What is their weight? What is their potential toxin exposure? Think of like alcohol, caffeine, tobacco, etc. Any environmental exposures. It's actually been well documented that certain professions, hairstylists who are in a hair salon with toxins all day, firefighters, long distance truck drivers. So there's certain professions that tend to have higher risk for infertility than others. So really trying to hone in on what risk factors this couple potentially has and how can we change or optimize those to potentially improve the likelihood of pregnancy, even if they end up doing treatment. So essentially enhancing the treatment process. And then the third is supplements or herbs. And these are going to vary a little bit depending on each couple's situation. But generally speaking, we do recommend that the patient be taking prenatal vitamins. Those prenatal vitamins should contain at least 400 micrograms of folic acid and ideally iron. So both iron and folic acid are the two key components to those prenatal vitamins.
Awesome. Awesome. Yeah, this is really helpful. And I think
Good.
we're already learning so much from this. So what are some common conditions associated with infertility in men and women? And when should people seek help?
Yeah, so infertility is actually a lot more common than people think. We know here in the United States, the CDC reports approximately somewhere between 10 and 13% of US couples actually suffer from infertility. So we translate that to roughly about 1 in 8 couples, which is actually a lot more prevalent than you think. If you have a group of friends and 8 or 9 of them are there in that group, at least one of them has probably gone through infertility themselves. So when we talk about what defines infertility, the classic textbook answer to that tends to be time of intercourse or timing, how long they've been trying. So for women who are under the age of 35, if they've been trying for over a year, it's probably time to see somebody. But because of the ovarian aging process, for women who are over the age of 35, we actually shorten that time frame to 6 months. So if you have been with your partner, you guys have been having unprotected intercourse for a minimum of 6 months, certainly at least 12 months, then it's definitely time to see someone. And at a minimum, you want to do a fertility evaluation. You just want to rule out that anything wrong is going on the male side with the fallopian tubes, with the ovaries, with the uterus. And then if everything is normal, having a discussion with your physician about whether to initiate treatment or not. And that's going to vary a little bit for each couple. I will say that the length of time a couple has been trying is really only one criteria, because there are other scenarios that are just as important to seek out help much sooner than that 6 or 12-month time frame. So for example, if a woman is skipping periods, she goes 3-4 months without a cycle, she's probably very happy about that, but it's not normal. So we know that women who are healthy, of reproductive age, and are not on any sort of birth control should be having a regular monthly bleed. And if that's not occurring, then she needs to have an evaluation for lack of ovulation. So she's not releasing that egg every month in a regular fashion. She needs to be tested to find out why, because if you're not ovulating, obviously that's going to make pregnancy more difficult. Now, another scenario that might be a little more subtle, but just as important, is a woman presenting with painful periods. So obviously periods are uncomfortable, and I think most women will agree to that. However, if the period is really debilitating, you're having to take medication, you're having to call out of work, you're unable to attend class. The classic story is a teenager who was skipping school once a month because she was just in so much pain from her periods. That is definitely not normal and definitely warrants investigation and treatment sooner than later. And then I will generally tell people, if there's known risk factors. So we know, for example, that sexually transmitted diseases can affect the fallopian tubes. If there's a family history of fibroids or endometriosis or other illnesses that may cause infertility. If there's a history of, let's say, cancer, for example, where they've undergone chemotherapy or radiation that may have impacted their fertility. So these are all different scenarios that would warrant seeing a fertility specialist specialist a lot sooner than those 6 months or 12 months that I talked about initially.
Right. Yeah, thank you for saying that. And I think some of those things that you mentioned also impact men, because I think sometimes when people think about infertility treatment, they're focused so much on the woman, but there are things like chemo and radiation that can impact men too, that need to be addressed.
I always say that the men are the forgotten ones on the fertility journey. We know that male factor infertility constitutes at least 30%. So at least a third of the cases that I see in my office are related to male factor infertility. And so it's really, really important if you are in a heterosexual couple and if the male is a part of your journey, there needs to be a sperm analysis, and there needs to be that, again, going back to that length of time, it needs to be much shorter if there's a known risk factor. Some men are like, oh, by the way, I had surgery as a child for an undescended testicle or an inguinal hernia, or I had, type 1 diabetes for the last 10 years. We know that chronic illnesses can absolutely, especially if they're autoimmune, can impact fertility. So yeah, I say that men are the forgotten ones in the journey, but we definitely need to remember that this applies just as much to them as it does to the women.
Absolutely. Awesome. So let's dive right in. Can you give 3 practical examples on how couples can boost their natural fertility?
Absolutely. So number 1 is going to be thinking about your lifestyle. And we mentioned some of these things in the beginning, but for example, let's talk about weight. We know that both men and women, if they are underweight or if they are obese, and I define obesity as a BMI over 30, we know that those different scenarios are increased risk for infertility. So those patients do tend to have higher rates of infertility than somebody who is normal weight. Another example would be caffeine. We know that patients who drink more than 5 cups of coffee a day, now remember in the Starbucks era, we talk about 5 cups of regular coffee. So it's not the triple venti shot, etc., right? And so you can get to that max pretty quickly if you're a big coffee drinker or an energy drink drinker. Those patients tend to have higher rates of infertility. Alcohol, we know that more than 2 drinks a day can be constituted. In our sort of wine culture, happy hour culture, get together with the buddies for drinks after work culture, 2 drinks a day is not actually that uncommon, and we see higher rates of infertility. So really thinking of being thoughtful, and I loved what you said in your intro about being intentional with your health. That's such a beautiful statement, and it really is being thoughtful and intentional. Am I really doing all the things that I can be doing to be my healthiest self, right? Because at the end of the day, fertility is really an extension of general health. And if you're not in good general health, that's going to be reflected in your fertility journey. So really thinking about lifestyle. The second thing I always address is any sort of chronic illness or medications. If you are using any sort of medication for pregnancy, or for a chronic illness, you want to make sure, number 1, that it's safe to use in pregnancy, and number 2, that it's optimized, that your illness is well controlled before you get pregnant. So basically, for example, if you have high blood pressure, you want to make sure that that high blood pressure is well controlled and that the medication that you're taking for your high blood pressure is safe to use in pregnancy. So patients, when they come to see me, will do a review of those medical illnesses and we'll make sure that they are optimized and stable before we initiate fertility treatment, because you don't want to be pregnant and then trying to figure out the medications at that time. And then the third thing is timing of intercourse. And there's kind of 2 parts to this. So again, if you're in a heterosexual couple relationship and the female is having regular monthly periods, then she should be able to track ovulation. And typically, if you've been trying for a few months, you'll have a good sense of how long your periods are. 28 to 30 days is about average. And so knowing how long your periods are, you can sort of estimate when that ovulation is going to occur. And I advise patients to use what's called an OPK, or ovulation predictor kit. So that ovulation predictor kit is a urine test, essentially just like you would pee on a stick for a pregnancy test. You're peeing on a stick to check for ovulation. And you typically will start that a couple days before your expected ovulation day. So you'll see a couple days of negative and then you'll get a positive. So you want to have intercourse the day of the positive and the day after. And that achieves two things. Number one is that it really optimizes the chances of pregnancy for that month, because you are, the sperm and the egg have the highest likelihood of coming in contact. So positive ovulation predictor kit, day of intercourse, and then have intercourse the next day. But two, I think that, and I had a great discussion with another colleague of ours about this, that intercourse on the fertility journey gets medicalized. It becomes mechanical. It becomes a chore. There's some providers that will say, okay, have intercourse every other day the whole month, or have intercourse for 2 weeks around ovulation. And it really becomes a task. It really sort of strips away any intimacy or connection for the couple. And so by sort of pinpointing these 2 days in the month, it allows the couple to say, okay, I'm going to compartmentalize. This is ovulation. This is baby making sex, right? So this is, we need to do this for pregnancy, but it allows the rest of the month to really be about intimacy and connection, which is so important in a couple that's trying to conceive. So really timing of intercourse is key. Now, if you're not having predictable monthly periods, or you're not able to track your ovulation with an ovulation predictor kit, ding, 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 time to see a doctor.
Right, absolutely. No, those are really, really awesome tips. Thanks for sharing those. And I think something you said earlier really rings true, like especially with the lifestyle changes that you noted. Regardless of how you get pregnant, these lifestyle changes hold true. Like whether we're going to do it through surgical management or medications or whatever we're doing, it's so important that we're at optimal health so that whatever we do has the highest rate of working. So
exactly.
Yeah, awesome. So I think you have something coming up. I would love for you to share it with our audience. Can you tell us
thank you. Thank you so much for asking. So the holidays can be an extremely trying time for couples who are having difficulty getting pregnant. There's the family member who's asking, oh, you've been married, for so long, what, still no kids, or, when are you guys going to have children? And others who give advice. They give their 2 cents, their opinion, and all of it is well-intentioned, I'm sure, or most of it, hopefully, but can add a lot of pressure and stress to an already stressful journey. So with Thanksgiving and Christmas and the end of the year, et cetera, coming up, I decided to put together a free masterclass on navigating infertility through the holidays. So really dealing with infertility through the holidays, I think, is important. What coping mechanisms, coping strategies to tackle that and really be proactive. So knowing that's coming, knowing it's stressful, how am I going to get out in front of that? So we're going to be doing it November 14th. So that'll be about 10 days or so before Thanksgiving. And we'll be doing it at 4 p.m. Pacific time. So more to come on that. I will definitely be advertising that as it gets closer, but I did think it was an important topic to cover given the time of year.
Awesome. No, this is great. November 14th, 4
At
p.m.
4 p.m. Pacific. Yes.
Pacific time. So we'll definitely have the link to register for that on this video. So that will be, so people can join you for that.
Perfect.
Awesome. So is there anything patients that have challenges with fertility can do with their primary care physicians that can be helpful before they actually see a specialist?
Absolutely. I cannot stress that enough. The primary care provider is huge in this journey, right? Because it keeps coming back to lifestyle and health. It keeps coming back to, are you optimized in your general health? Are your medical illnesses? So let's say weight is not a problem. Let's say there's no family history of illness, but let's say you have thyroid disease. Is that thyroid well controlled? Are you taking the appropriate dose? We know that those requirements go up with pregnancy. So are you at your best self going into your fertility journey? That is all something that can be done by a PCP. That does not need to wait to get to me. And in fact, most people that you will talk to on the fertility specialist side, on the herb and supplement side, all that data shows that we want patients to be optimized really 3 months before they even start trying. So those folic acid stores that we were talking about, the iron supplementation we were talking about, that lifestyle optimization, we really want that all happening even before they ever get to me. So that is really a journey that you can start to explore with your primary care provider, provided you have the time and they have the time to sit down and go through that with you.
Absolutely. No, I totally agree. I think, and it saves them time too. Like while you're, before that first visit, if everything is optimized, you can jump right in versus doing that first.
Yeah. And
Yeah.
I can't tell you, in the older patients, so women who are over 35, it becomes a little trickier because we don't really have the luxury of time. But in my younger patients, I can't tell you how many times I will say, look, let's focus on your health journey. Let's get that right. And then come back to me in 3 months or 6 months and let's see where you're at. So if they had started that journey beforehand, then that visit would have been, okay, you're doing everything you can. Let's move on.
Right. Exactly. Awesome. This has been so awesome. So any parting words or advice or quotes or anything you want to leave our listeners with today?
Yeah. So I think the biggest message I want to give is don't underestimate the power of good health. And I think, we share a common mentor. The simple things are sometimes the hardest ones to do, is something she always says. And really, we all know what we should be doing, but are we doing it? And fertility patients tend to be some of the most motivated patients out there because family building and having a child is so, so important to them. And I think they're so focused on the menstrual tracking and the ovulation and the intercourse and all of that, that they are really missing this huge link, which is the good health piece. So don't underestimate the power of good health. Fertility is an extension of your general health. So if you're in your best health, that's only going to optimize your fertility journey. And hopefully that helps your patients and your audience.
Awesome. Yeah, thank you. And it will, when you're healthy, it also helps do many other things, right? Prevent serious health conditions. You can actually be there for the children that you're trying to have.
100%. 100%.
So there are many other reasons to, to
Yes.
be happy during this time. So how can people find you? Do you have any website, social media handle?
Yeah, so I have a YouTube channel where I post weekly videos with just 10-minute sessions on different infertility education pieces. So if you go to YouTube, you go to Dr. Carolina Sueldo and you'll find the channel there. Please feel free to subscribe. If there's any particular content that you like, feel free to drop a comment, let me know what you thought. And then I'm also on social media. I'm both on Facebook and Instagram, but much more active on Instagram. And in my link on Instagram, you'll have the sign up for my weekly newsletter, and that's where you'll hear about all my events, including the masterclass coming up in November.
Awesome. Thank you for sharing that. And we'll have all that information in the chat as well. So we've come to the end. This has been so great. Thank you for listening. Remember, share with someone who may need it. And if you're in the Houston area and you need a primary care doctor that is detailed and proactive about your health, check us out at In Touch Primary Care. You can find out more about how we operate on our website, www.intouchprimarycare.com. And lastly, we are actually going to be having a free informational webinar on lowering blood pressure with lifestyle changes this Saturday. It's Saturday, October 22nd at 12 noon. You can register with the link in the chat, and there will be opportunity to ask questions at the end. So if you have high blood pressure or you know other people that have high blood pressure, please share with them. Well, thank you again, Dr. Sueldo, for coming. Truly appreciate you being here today. And thank you everyone for listening. Have a great day.